Welcome, everyone. I'm so glad that you guys are here sharing this with us and being here today and just being survivors and thrivers. And so we just want to welcome everybody. Today we have Jacqueline Tolentino. I hope I said that right, Jacqueline.
You did.
And she's going to be our presenter today. My name is Charisse Oliva, and I am currently a 3-year breast cancer survivor. I attended my first YST when I was newly diagnosed, and it was amazing. I met some amazing people. I've done a lot of great things with them, and I wish we were in person because it's just even more amazing in person. But this is special, and I'm glad we get to do something this year. Last year, not being able to attend one was really hard and really miss it. So this year, I'm glad to jump right back in. And with that being said, I'm going to turn it over to Jacqueline. Just a heads up, guys, if you want to chat your questions along the way, Jacqueline's going to answer questions at the end of her presentation. We'll have about 10 to 15 minutes for Q&A at the end. So please just chat me your questions and I'll turn it over to Jacqueline.
All right, let me share my screen. Let's get started. I hope everybody can hear me okay. I am Dr. Jacqueline. I work at Parsley Health, and today the topic is going to be cancer and cannabis care. The question is, can medical marijuana help you? And as a functional medicine practitioner, I think that this is a really important question, and it's one that we all have to ask ourselves. So just a disclaimer here, everything that I'm presenting today, it's for informational purposes only. It's not intended to be a substitute for medical advice, diagnosis, treatment. I want to make sure that you consult with your doctor regarding anything that you hear about. And medical cannabis treatment should never be undertaken without the supervision of a qualified medical doctor. That's a really important point. So I'm actually board certified in family medicine, and I practice functional medicine through the Institute for Functional Medicine Training, and I work at Parsley. We see patients all over the country, and what we do is we create wellness partnerships. We are the largest holistic medical practicing in the US. I'm licensed in both California and Florida. I am a medical marijuana qualified physician, and I'm also on the virtual team. So I don't go into an office anymore. I just see patients virtually. If I had to pick a color or use one of the colors that Charisse mentioned, mine would be green, I'd say, because July will be my 5-year breast cancer anniversary. So cannabis is medicine. Medicinal cannabis, it's been used worldwide, dating back thousands of years. Egypt, China, India, Greece, and the Islamic world. And what I find most interesting is that we had used cannabis throughout the 19th and 20th centuries, but then in 1937, the Marijuana Tax Act restricted its sale and use of cannabis. And that's what really shifted the gears and put things into motion with all the restrictions. In the 50s and 60s, there were penalties for for anyone that had cannabis possession. So this is when things really started to vamp up. What I put in bold here, the Controlled Substance Act of 1970, cannabis at that point in time, so we're talking 41 years ago, was classified as a Schedule I drug. And this means that it has no acceptable medical use and high potential for abuse. That's what they had thought back in 1970. So today, 41 years later, it is still classified as a Schedule I drug under the Controlled Substance Act. But take a look at all of the states that are listed here, where you can use it for adult use, for medicinal use. And I did note at the bottom, there are a couple states where it's completely illegal. So this is just an updated list. You might want to take a screenshot here so that you can see which states are actually involved or still participating, despite the fact that it is still a Schedule I drug by the Controlled Substance Act. The endocannabinoid system. I'm sure you've all heard the term. And what I love about it is that it is a biological system that is in all mammals, vertebrates, and even invertebrates. So even animals have an endocannabinoid system. And it's really unique to each one of us. So each of us, all humans, have this system of different types of molecules, receptors, and enzymes that all serve the purpose of helping to support your body in different ways. We know that the endocannabinoid system is great for mood, anxiety, pain, for use in cancer patients. We also know that it is throughout the body and it supports digestion, it supports brain health, And there is so much more research that's going into the system because of how fascinating this is. But once it was discovered, you realize that there's far more to it than just medicinal cannabis. This is a system where our body is also creating a lot of these molecules themselves. So I think that the most fascinating part about it is that it's unique to each of us. We all have one, and it can be up or down regulated with the use of cannabis. So here's how it works. There's all of these little molecules called cannabinoids, and they interact with these different receptors in the body. Receptors are like little satellites that are sitting on all of your cells. And there's concentrations of different types of cannabinoids in different parts of the body. The most common ones that we think of are THC and CBD. So the question is, can cannabis help you? Can medical marijuana help you? The answer is maybe. It might be able to help you. And it is so important that if you are interested in exploring this, that you talk to a qualified physician who is well-versed in cannabis as medicine to determine if it's really safe for you or not, or if it's even appropriate, depending on where you are within your healing journey. For some patients, it might be something that they want to consider early on. For others, it may be something that they would consider further on down the road. But I think what's also important here about what I said earlier is that this system is unique and is involved in your own body response from a physiology standpoint. So there are things that we naturally do that stimulate the endocannabinoid system in your body that have nothing to do with medical cannabis. So if you think about it, there are foods that stimulate this. Exercise helps stimulate the endocannabinoid system. The way that you sleep stimulates the endocannabinoid system. How stressed out you are. And for those of us that have all been here and gone through breast cancer, you know that stress plays a huge role in so many things, but it also plays a role in how your body's endocannabinoid system is working. So if I had to answer this question, and this is why YSC brought me here today, I'd say maybe it might be helpful for you. And it's so important that you talk to a doctor who's well-versed in this to make that decision. So a little bit about what cannabis can be used for. It can be used for chronic pain, for neuropathic pain. It can be used for chemotherapy-induced nausea and vomiting, sleep disorders, anxiety. And this is a really short list because you also see that it's used for digestive issues. It's used for PTSD. It's used in immunocompromised patients that are going through HIV or AIDS. So there are so many other reasons why some patients might consider cannabis, but this is just a short list of some of the main reasons why. Here's the different types of delivery methods. You have inhalation, there's oral capsules, tinctures, edibles are really popular. There's lots of topical preparations now where they're also using things like magnesium, different types of lotions to help with the delivery method to get this in the body. And then there's even rectal suppositories for it. How you use it, it depends. So the delivery system that you use can depend on all different kinds of factors. First of all, you should be talking to your medical cannabis physician about this. It depends on what types of symptoms that you're trying to support and treat. It depends on what you were diagnosed with and where you are exactly in your cancer journey. It depends on your tolerance for different types of products. So some people, you'll hear that they just don't do well with certain types of cannabis or their body just doesn't feel well. And I think that's an important thing to consider too. There's certain types of preparations where you can really help control the dosage that you're delivering to yourself. And then there's other types of preparations where you have less control. So this is why it's so important that you talk to somebody who is more knowledgeable in this so that you can get the right advice and you can feel comfortable with what you're doing. This wouldn't be appropriate to talk about without talking about some of the risks and concerns. There's these adverse reactions. People can get dizzy. You can have visual disturbances, dry mouth, anxiety. You can feel super sedated and really fatigued and tired. Sometimes it can interact with medications or even supplements. And it does have this depressant effect on the nervous system when you combine it with alcohol and other medications, which is why it's so important to think about your cannabis use in regards to all the other things that you're doing, medications, supplements, your lifestyle, etc. Here's some contraindications. So for people that have acute psychosis or are suffering from different psychiatric conditions, it might not be appropriate for you to use it. If you have severe cardiovascular, immune issues, liver, kidney disease, and for those that have issues with your heart, with arrhythmias. So examples of patients that are typically not candidates for cannabis use. Cannabis hyperemesis syndrome is associated with those that have had really chronic cannabis use over many years and long periods of time. And it is an actual thing where people can get lots of episodes of nausea and vomiting, abdominal pain, and feel excessively thirsty and can create dehydration. You can even be hospitalized for this condition. So it is so important to talk to your doctor. What kind of symptoms are you having? Each state has a very specific process for allowing patients to consider using medical cannabis, and you have to take a look at what the requirements are in your state. Are you in a state where you can use cannabis or not? And seeing a doctor who is well versed and researched in cannabis as medicine for whatever it is that you're trying to support in your healing journey, so important. So next steps, respect the power and the potential of cannabis, approach it with knowledge, but make sure that you're cautious. If you're using it for medicinal purposes to try and help treat something specific, it's so important that you talk to a doctor that's well versed in this. And for those of you that are using any type of form of cannabis, journaling and writing it down and seeing how you feel whenever you take and use certain types and different delivery methods, it's important because this gives you perspective on what's going to work or what isn't going to work for you. And your medical cannabis doctor is most likely going to recommend that as well. So if you have any additional questions after the upcoming Q&A session that Sharice is going to go through with us, then you can feel free to email me. So I put my personal email address on all of the free presentations that I do, because I think it's so important that if you're looking for somebody to have a connecting point and you have an additional question that is a little more intimate, feel free. This is my email address and you can put that in the subject. If you're interested in learning more about me and Parsley Health and where I practice and who I am, you can check me out on social media at Dr. Jacqueline Tolentino. And that's all I have for you today. Looking forward to your questions.
All right, everyone. Thank you, Jacqueline, so much for all the information. So what I wanted to share, in case you didn't see the chat, I wanted to share some information or some, Auntie will help you. Go, Auntie. Sorry, have my granddaughter today. So I wanted to share with you guys just some information that was shared in the chat. Someone did say that it is legal now for medical in New York as of this year. And a lot of people said it helps with their insomnia. Also, for bone pain, it helped better than Claritin and Tylenol. And another person said it, pain, sleep, anxiety, libido, it works magic. And another person uses it on their back for a balm on their back. I use a CPD balm for some aches and pains, and it definitely works for me. Jacqueline, maybe you could answer this question. Have you heard about vaginal suppositories for PMS?
Yes, I have. And I have patients that have amazing results for that. They have amazing results for it with PMS symptoms, including pain as well with the vaginal suppositories. For women that are suffering from different types of conditions, like even endometriosis, there are a few companies where patients have tried out their CBD suppositories and they've worked really well for that. Topical preparations, some patients, if you're in a state where it's not recommended or you're not allowed for state regulations, some of the CBD balms, like you mentioned, Sharice, you can mix those in with other things, right? So if we're thinking about topical, you can mix that in with magnesium. You can mix it in with shea butter or a lotion that is really going to deliver it directly to muscles. So I do like the topical preparations too. For those of you, even after a double mastectomy, I had a double mastectomy, I found topical to be really helpful for that as well.
Perfect. So another question, and it's kind of maybe a tough question. Do you have any advice for someone who lives in a state where it's illegal, how they would be able to seek treatment for it?
Yes, that is such a difficult thing to answer. What I've heard that patients do is some people that are really interested in this kind of medicine, they will advocate for themselves by even traveling. So that may be another possibility, establishing care in other states. I've heard of individuals doing that.
Yes. Okay. Do you have any tips on how to talk to your doctor about it? I know it can be tough to bring up at first.
Oh, it is so tough to bring up. I think that the best thing to do is be perfectly honest with your physician when it comes to speaking to somebody that you know you can trust, that you feel really comfortable with. So along the cancer journey, it can be really scary because you're going to talk to a lot of different doctors, so many different kinds. I think I probably talked to like 15 different doctors with my own care. And you might intuitively feel really comfortable talking to one in specific. You might feel really comfortable talking to a cancer coach or even a psychologist or a therapist. But confiding in a health professional and being honest about your consideration here, you want to make sure that somebody is aware that can help guide you, that you feel comfortable and that you can trust. So if you don't feel comfortable talking to your doctor about it, that makes it all the more harder. But this is your doctor who is trying to help support you in whatever way they can on your cancer journey. So they are your advocate, they are on your side. Being honest about how you feel, as much as possible, I would still kind of put that in there and be like, look, from my own perspective, I'm learning a lot and I'm interested in considering this as a treatment option, maybe now or possibly in the future. Can you tell me more about this? And, depending on where you are in your cancer journey, it might be great to consider this. It might not be. And so it's important to have that professional give you their perspective. Regardless, what you do is all up to you. This is your body. You get to make decisions. You're utilizing all the knowledge that you're going to gather from lots of different resources, and trust yourself. We are so resilient. Everybody is here. I'm so honored to be amongst all of you because we are here because we care. We care about ourselves, we care about our bodies, and we want to learn about all of the different options and treatment tools for us.
Exactly. And I just want to kind of chime in on that too. You have to be an advocate for yourself. If you're quiet and you just allow, you have to be able to speak up. It's so important to be able to advocate for yourself. Whether it be for this or any other subject, it's very important to advocate for yourself and just make sure you do what's right for yourself without judgment and anybody else telling you that this is wrong. You have to do what you feel for you. Nobody can explain to you how we feel during cancer unless we've gone through it and you've been through that treatment. But another question for you, Jacqueline, thank you so much. How do you know which strain to pick and which type is best for you?
Also a tough one. So I remember when I was going through the earlier stages of my cancer journey, I was so overwhelmed with all the different options. There's lots of different websites online where you can learn about the different strains and you can learn about the terpenes and the aromatic compounds that are included in them. I would at least seek the advice of there's certain websites, I'm not sure how far into this I'm allowed to get, but look for trusted sites that are also associated with the Society of Cannabis Clinicians, doctors that are really well versed in this type of medicine, because there could be certain types that are great for you that might work well, but each strain is unique. There's also companies out there that are doing genetic testing, so you can at least learn about your body from a physiologic standpoint as far as what might fare better or worse, what ratio of CBD to THC, what strains, and speaking to that point, what might be helpful. So there's companies that are doing genomic testing based off of data from like 23andMe or Ancestry to help give you that information so that you can learn about your genes and how that might impact your cannabis use.
Perfect. Okay, so do you know about the possible interaction between CBD and tamoxifen?
Tough one. There is research on this topic. I think that there needs to be more research into it in order to make, 100% claims here. It has been studied, and I think that we just need more information. So I can't comment on that at this time.
Yes. How do you find a knowledgeable doctor in your state?
Internet. And even even with YSC, we can put together some resources and maybe create a blog post of some kind, to help patients that are interested in that. I'd be happy to contribute some knowledge there when it comes to, what websites and resources to consider. In your state, there are physicians that are on a list of some kind. I have to look where that website would be. It might be state specific, where you can have advice, from a trusted health professional who knows about this kind of medicine. So.
Okay, we have about 10 more minutes. So another person asked, and you kind of because there's not a lot of studies, you said, someone had a question, does CBD interact with certain chemos? But again, because of, I guess it's my daughter was actually having a conversation with this about it yesterday with me, saying that it's not technically FDA approved, so there's not too many studies. Is that correct?
Yeah, I just think it needs to be researched more, you know? And we have to keep in mind that if each of us has a unique endocannabinoid system, maybe it was upregulated and downregulated from lifestyle. So there are foods that act as natural endocannabinoids that can help support us. They're phytocannabinoids is what we call them, chocolate being one. Omega-3 fatty acids, essential fatty acids that we get from fish and extra virgin olive oil and nuts and seeds, even hemp seeds. You know, there's lots of sources. Interestingly enough, some of the most powerful herbs that we use to help fight cancer, like curcumin, are also considered phytocannabinoids because they help upregulate the endocannabinoid system and help support it. So there's kind of a lot out there where we don't have to go straight to medical cannabis as a potential solution. We really have to take a step back and think about all of these things that might affect how it's working and then decide from there.
So for mental health disorders, would you suggest that they talk to their cancer team, or would you suggest they talk to their psychiatrist about the possible use of CBD or medical marijuana?
I would talk to your psychiatrist, or even, you know, if you're seeing a psychologist, you know, as well. There are some that deal specifically with cancer patients. You know, I would choose that route, but eventually we're talking about synergy in your care team. Your whole care team should know. You know, I find that it's difficult because some people feel uncomfortable about, again, who they feel like they can trust and who they want to confide in. But when we're talking specifically about mental health, great conversation to have with your mental health team, your psychiatrist, your psychologist, as a starting point. Mhm.
So if what if your care team has a problem with discussing cannabis use, and also you kind of mentioned about the virtual setting too. I think this would be a perfect place to kind of input it. If your team doesn't or support you on that, you might possibly look for another doctor that virtually that could talk about it with you. Is that a
Okay.
possibility?
Yeah, that is a possibility. And, you know, those that are well versed in cannabis as medicine, they've gone through specific training to understand where it's appropriate within a cancer journey, right? So each of us is really unique, and we might be learning about cancer early on. Some of us might be learning about cancer, and this is like years past from when we were diagnosed. Regardless of where you are in your journey, it would be so important that if you're using it from a medicinal standpoint, not recreational, but from a medicinal standpoint, that you're talking to a clinician who is well versed in that. And yes, there are some virtually. Mhm.
So a question, and I know the answer to this one. It says, do healthcare facilities deny employment in legal states that they drug test? And the answer is yes, because it's not federally recognized yet. So so for example, my best friend's an HR business department for nationwide. So if you it is not until it's federally recognized, it cannot be um, it cannot be waived as a drug test. But most companies kind of, I mean, it just depends. But do you want to answer that one too,
No,
Jacqueline?
I totally agree with you, Charisse. Each company, though, you know, despite that regulation, companies are compassionate about their employees. They're going to think about this use, how it's affecting the work and performance, you know, what it's being used for, whether or not people have already sought the advice of a medical professional that's well versed in cannabis medicine in certain states, like the state of California, to use it for medicinal purposes. You know, you would have access to a medical marijuana card, and you would see a health professional to get that and obtain it and then decide from there. So, you know, there's still advocacy for yourself. Some companies, you know, still lend themselves to be compassionate about each unique situation.
Exactly. So someone asked earlier on if this presentation would be shared, and all of our presentations today, yesterday, all of our presentations all weekend long will be shared on the YSC site. So you will be able to have access to it. So we have another question, and I know we have like 4 minutes left. So do you know any organizations that focus on providing cannabis education and resources for medical use? Are those receiving cancer treatment?
Society of Cannabis Clinicians would be a good place to start. There are a few other national organizations. I can't recall off the top of my head, But seeing how much interest there is in this topic, Sharice, I think it'd be great for us to provide some additional information afterwards. I'd be happy to consider contributing to like a blog post where we can answer some of these additional questions. And feel free to email me. I gave you my personal email because I want us to stay connected.
Absolutely. Just for my own personal use, when I was looking for a CPD, I'm a school counselor, so I had to be very careful on making sure that I didn't, because I transport students sometimes, so I had to make sure that I didn't have any type of THC. For me personally, it wasn't. It was just obviously for my job, so it was very hard to make sure I picked a company that was legit and reputable. So it was definitely very hard, and you have to be very cautious, especially if you're in a place where it is not illegal, but you can't have it in your system. Otherwise you could lose your job for it. So definitely being cautious with that. One more question that I had for you was, you mentioned the genetic testing. Do you know where you could get that done? Where you said, I know 23andMe, you said, is there additional information on that?
There are two companies. I believe both of them are in California. I'll have to look it up. I know that it's
Okay.
not expensive because I had looked this up myself. What I can do is on Insta story on Instagram, I could look it up and put it up there later on today.
Perfect.
For those of you that are interested in that.
Yes, definitely. Because I think now, even for me being diagnosed, and you probably can answer this, I know the BRCA testing, BRCA only had us, up to BRCA3. And is there additional BRCA tests now that is all related to that as well?
Different type of genomic testing, but I'm sure there is. What's available to the public. They're still deciding from a research standpoint. So the validity of the testing and what it means is important for us to understand that too. It's not just about testing it and knowing, but what does it mean when we gather all this data? So separate, I think that the testing that they're doing for genomics and how people respond to cannabis isn't specific to like disease states or condition. It's more like, this is your data. When you have certain types of single nucleotide polymorphisms in your genes, you might fare better with certain types of cannabis.
Perfect.
Certain strains of CBD or THC, etc.
That's amazing, because for myself, for me, it wasn't working at one point. So that would be good to know, because for reaction purposes, and that makes total sense now to think that, okay, this wasn't working because of your genetics. But we have about 1 minute left. And if you would do me a favor, Jacqueline, if you could share your screen again with your information for your email. A couple of people had some questions on that. So if you would just mind sharing that screen for me. And just thank you again for your time and your information. I think a blog would be amazing for everybody, and that would be just so helpful for all of us, and being able to look at the different information that you shared. So I appreciate you being here with us today. It was an amazing session. It was great for us, and I'm really thankful for you volunteering your time and presenting to us today.
No, thanks. An honor to be amongst so many amazing, incredible people here. Thanks for showing up for yourself, learning more, and feel free to email me. If you have other questions that you'd love for me to put into this blog article, I'm happy to do so. So feel free to send me a message, things that you want to learn more about when it comes to this kind of medicine, and let's see what we can do, what we can put together.
Perfect. Thank you so much. And I believe, Kat, you're going to take it from here to share with us our next session. So our next session up next is if you want to visit the exhibit hall, guys, go look at the exhibit hall. There's a lot of great information on there, a lot of great vendors. So we appreciate you, and thank you all for being here today.
Bye.
Bye, everyone.